Well, thank you very much, Alta. I'd like to start by thanking you and the organizing committee for bringing us together and having such a fantastic array of speakers, commentators, and participants. Thank you also very, very much. It's marvelous, and especially Alta, thank you. And I want to also thank our staff who are here, Adam and Andy and others who helped so much. I really appreciate everybody's engagement and involvement in this program. What I feel thinking and listening to this is how much opportunity there is for a higher order of collaboration, especially across the scientific, clinical, and patient communities. I know that the groups like the Alliance that Athersys and others had started already involves a number of groups. I know the International Society reaches out in many ways. But I came away thinking through the course of this day that there's just a huge opening of interest and need on all sides for a genuine continued dialogue and a better and clearer definition of what we want to accomplish together and what the most important problems are now for us to try to solve together. I also couldn't help but think back about the experience in the HIV community starting back in the 1980s. I remember so vividly when ACT UP began as a patient movement. And it was, of course, very disruptive. And for everyone in the scientific and health communities, it was kind of offensive to difficult. It was somewhere in this vicinity. But dialogue did continue. It did eventually take place. And you really have to give credit to people like Tony Fauci at the NIH, and then leadership, especially from the group that formed what was called TAG. This was the offset of the offshoot from the ACT UP group, who really focused on what was needed for clinical trials. And they submitted protocols. They developed ideas that actually ultimately prevailed and led to the development and the more rapid proof of the protease inhibitor strategies and the development of multi-drug therapy. And it was really a prime example to me of where the scientific community, the patient community, the clinical community actually could accomplish so much more working together. But finally, there's another lesson I take away from that experience. What will solve this problem for stem cell research, above all, I believe, will be effective therapies with stem cells. Until we have regenerative therapy that is demonstrably, regularly, and reliably successful, we're going to continue to have a lot of deception, opportunity for everything from fraud to exploitation of desperate patients and families all around the globe. And so I think the onus is back on us in the scientific and health communities to enlist the patients, to enlist the clinicians, to persuade the funders, and to get on with the business of accomplishing what the promise of stem cell research has held from the very beginning, which is successful treatment.